Let's continue with our discussion of Auriculift or auricular facelift or auricular Aculift. So there are actually steps that we need to follow when we do the Aculift. So this is for because we just don't deal with the face, no? But remember, this is auricular Aculift. So we will be showing you the counterpart on the ear. On the ear, we will be using 3 types of needles. We have the intradermal needle. We have I cannot remember the size, but it's quite short. And because I don't want the ear to be so overwhelmed with needles. So that's why we have to focus on using, because remember, we will not use the body, but for those who are already certified, you can actually take, you might want to have these notes, okay? So first we have the initial grounding. It is very important to ground the patient because if you do the body acupuncture, the facelift, there will be so many needles on the face. Diba? So if you don't needle the lower part of the body, especially the legs and feet, no? So, and also you did not do anything about the back, the treatment may not be that effective. Okay? So this should consist of 10 to 12 sessions, twice a week for the first 6 sessions, and once a week for the next 6 sessions. Okay? And then regular maintenance treatments will be done every 3 months. And if the effect would last for like 5 years. Diba? Okay, so let's start with the initial grounding. These are the points. I think you're experts na, no? Bladder 13 is, you do this bilaterally. Bladder 13 is back shoe of the lung. Bladder 14 is back shoe of what? Pericardium. Bladder 15 is heart, diba? Bladder 18 is liver. Bladder 20, back shoe of the spleen. Bladder 23 is back shoe of the kidney. So why do we focus here? Because lung is skin. The lungs control the skin, like bladder 13. 14, 15 will deal with the circulation, the heart. Bladder 18 is liver. And bladder 20 is spleen. And bladder 23 is kidney. Remember, spleen and kidney, they have a harmonious relationship. No? That's why if you have spleen yang deficiency, it will also affect your kidney yang deficiency and vice versa. So for the legs and feet, you needle liver 3, followed by stomach 36. So it's like going to the, then spleen 9, GB 41, and stomach 44 in that order. So for the ear, we can use smaller, shorter needles. Hands and arms, we use this to anesthetize the patient so that if you use the face, it will not be that, it will not have so much discomfort for the patient. No? LI4, pericardium 4, Sanjiao 8. The head and forehead. So if we deal with the head and forehead, we deal with the do 20. Now, when you needle do 20, since we'd want to lift, it should be, diba, the direction of flow of the chi is going up. Diba, from back here. So how are you going to needle? So you don't needle pababa, you needle to the nose, towards the nose. Okay? Away from you, because you want to lift. Diba? Then intang, and then bladder 6, gallbladder 14, and the forehead point, which is actually an extra point. The ears, okay. This is my advice for you. Needle the ears first. You can use shorter needles, Shenmen, the mandible, the eyes, cheek, and mouth. And make sure you needle this bilaterally. Otherwise, or you might want to check. No, first, just like what we did last. Remember Sir Albert? No, they needled only one side of the face, on one ear, and
Yes, Doc.
they were all panicking because only half of the face was lifted. So
Yes, Doc.
don't
Para
panic.
po nag-Bell's palsy.
Yes, and they were seated. Preferably, this should be done on a, kasi I had to make sure they had food in their stomach, no? So kailangan mga nakakain at least 1 or 2 hours before the procedure. Otherwise, baka, lalo na pag nakaupo, you might have a patient who will just doze off, no? And try to make your patient feel awake, okay? Baka mamaya hindi na magising, okay? So Shenman, the very popular Shenman. Then you look for mandible, the eyes, the cheek, and the mouth. Diba? Mandible. Then the eyes, diba? Gusto natin mag-lift yan. Then the cheek and the mouth. You know. Next, the eyebrow, you needle Hu Yao. Bladder 2, Yu Yao is here. Bladder 2, Sanjiao 23. Okay. Then jaw, 2, 1, and 3. We'll show that to you later. Front of the face, we use um, the cheek point, the stomach 4, then stomach 4, Li 20, stomach 3, Si 18, stomach 2. The chin, Ren 24, the neck, okay, Si 17, dito yan. Ano, dito pala. And then the triple heater 17, Ren 23, stomach 9. We will show this later. Now let's talk about the initial grounding. This is what we call the detox. We only do this sa first session kasi this might take like 10 to 15 minutes. No? Okay, the idea here is you needle when you use the ano if you're already certified. You wait for it to turn red. No? This one. It will turn red if it has to be needled. And you have to wait for the redness to disappear. So, andito po yan sa ating ear. Remember our technique? This one, bladder 10, this is the cruise of the helix, bladder 30 dyan. So, bladder 13 must be somewhere here because this is bladder 20, yung gitna. Okay? You would know it because may konting pain. Especially when that patient is complaining of back pain, no? And the patient will think, ay, nawala yung back pain ko. Minsan, uubo-ubo ng konti, no? Or sisipon. Bladder 14 is here. So, konting taas. And then, sometimes we just forget about bladder 14. We can use bladder 15, which is the back shoe of the heart. Kasi magkalapit lang sila no? Bladder 18 is important, especially if you see na medyo mabagsik yung pasyente, maraming emotional issues. Okay? Nanilisik yung mga mata. And then we have bladder 20. Now, I would always needle this is if the patient has, okay, malaki yung tiyan, no? And also when this one is so like, kasi ang bigat yung dito. Yung dito na ba yung nagdo-double chin? So, it will help lift so get rid of the phlegm. So it strengthens the spleen. You know how back shoe points work? The back shoe will actually tonify the organ directly, no? And it's usually chronic. Kaya nga naging ganun yung mukha natin because chronic, matagal na siya, no? Kaya nasa likod siya, okay? So bladder 23. So if you know the outer back shoe points, you might also want to, especially, saka na lang yun yung mga addiction, no? But ito na lang muna. And this one really helps, okay? You don't have to needle all of it. But if you can, then do, no? So when we meet on Friday next week, I will show you the needles that I that I like for those points. Okay. And also the intradermals. So for the legs and feet, we have these points in that order. So first, liver 3, one of the 4 gates, remember? Importante yan. So liver 3 on the ear is here. Okay? Needle mo sabay. Ay, hindi pala, sorry. You can needle this on one ear lang, especially if so for grounding kasi, a needle na lang both. Oh, it's up to you. Pwede rin i-alternate, liver 3 dito, tapos sa kabila yung isa. No? Yun. Stomach 36, you know this. So, in that order, so liver 3, stomach 36, then you go to spleen 9. Dito po yung spleen 9. So if this is 7, so spleen 9 should be somewhere here. This is 10. GB 41. So nasa likod ng tenga, here. Then stomach 44. Okay. So should be here. Diba 42 eh. This is 45. 44. Okay. Now, hands and arms, para hindi masakit, you use Li4, PC4, and Sanjiao 8. So Li4, the very famous Li4. Then the pericardium 4. Pasensya na, nawala yung picture ng Li4. I think it's in your notes na. This is pericardium 4. And then Sanjiao 10. Sanjiao 8. Sanjiao 8. So here is Sanjiao 8. Okay. Now let's go to the head and forehead. So these are the points. First, do 20. So how do you needle do 20? Pag ganon. Kung gusto mong lalong magsag, edi pag ganon. Diba? Do 1, then do 20 dito. Yeah, so do 26, no? So, towards the nose, yung pag needle. Okay? Or, you do this. Ito na lang. But make sure you needle both. Do 20. Okay? Masanay kayong dalawa. Okay? Then we have the intang. So since this is located in the forehead, you might want to locate number 53. Where is 53 here? Here. Ako, I would usually put intradermal. You can let it stay for 1 week. Pero sabihin mo sa pasyente to come back if it's painful. Okay? So you look for the tender area. I tell you, it really works. Okay? 53. And then for those who are certified, you can use you can do, this is very common. Actually, I use intang to make the patient feel comfortable. And after you needle intang, they will say, sige, you needle na anything. They would love you to needle them already. Okay. And then we have bladder 6. So if this is bladder 5, so bladder 6 is here. So, you know how to locate do 20, diba? So, 2.5 soon from there, that's bladder 5. Okay? Or, you needle dito na lang. I suggest you needle the ear. Nobody will complain. So, where is bladder 5? So, 1, 2, 3, 4, 5 here. Okay? Yeah. So, di ba malapit din siya sa forehead point? Make sense? Di ba this is forehead, oh? 53. Oh, so, nandito po yung bladder 6. Okay? And then dito ang This is when you needle. And then ito naman is, GB14. This is one tune from the midline of the eyebrows, right? 1/3, 2/3 dito. So, ang GB14, so this is 21, so it must be somewhere here. Okay? That's GB14. So ngayon, when you needle, papunta na doon, paakyat. Kasi you want to raise it. And then we have the forehead point. You have to keep, pull talaga. This is actually an extra point. No? So again, you can look for it here. Ito or ito. Okay? Now let's go to the ears. So as I mentioned earlier, unahin mo na to, baka makalimutan mo pa. Shenmen, mandible, eyes, cheek, mouth. Or if you want to needle all, which I feel hindi na necessary, no? So Shenmen, mouth, eye, cheek, mandible. Personally, I will always use the Shenmen point first. It's left, sa left, no? And then right naman yung kabila. Okay? So it's up to you. And the points that are very successful are mandible, eyes, cheek, mouth. Yun na lang. So you needle both. So where is mandible? Okay, you look for it here. Okay. You have the charts. So that's Shenmen. Now let's go to Hu Yao, the eyebrow. Now when you needle you will be using intradermal needle here. Wag yung needle kasi and you have to be very careful because the eyebrows masyado siyang masakit. Ang dami kasing nerve endings dyan. Okay? So you have to pull pag ganon. Then you put the intradermal towards you. Okay? And find a very good, mamaya ipapakita ni Sir Albert yung, ano to? The tweezer. Okay? Na na-discover niya. May na-discover din akong tweezer. But when I ordered from someone, parang hindi man maganda yung tweezer. Pang eyelash. Wag yung tweezer na pang eyelash siya. Oo. Pakita ni Sir Albert mamaya. Okay? So first you needle the Hu Yao, then the bladder 2, and then the triple burner 23. So ipupul mo yan pataas. Hilahin nyo. Okay. If you use the intradermal needle, hindi naman acupuncture needle ang intradermal. So it's okay for you to use it. Okay? So, there. Demonstrating needling at Yuya and the intradermal needling technique using wide grip tweezers. Okay? Then the eye point is number 50. Andito. Remember the eye? For those who attended last time, you will find those points very useful. And then this is Sanjiao 23. Okay. So andyan na yung ano, you see the needles are they're not actually very visible. Okay? Now let's go to the jaw. The jaw, it's like preparing your canvas, like when you do painting. So, do you get the point? Ito hinihila pataas. Ito na ang pag-ano. So if you're certified, you can use 213 here. So first, hanapin niyo po yung stomach 5 or you ask the patient to blow. Diba may bubukol dyan? And then you go down. That should be your jaw point 1. And then punta ka dun sa front, mga 1 tsun away. And then the back, another tsun away. Okay? You follow? So parang ginaganon mo siya. Then ito, tutusukan mo, which is another extra point, the cheek. So when you needle this point, the patient should be able to tell you, ay parang kumapit, parang nag-tighten. Okay? So, Yun. Actually, most of our therapists, they already know how to do this. Okay. The jaw. So if you don't want to needle the jaw, natatakot ka. So, by the way, use, tawag dito. Yeah, so si Sir Albert will show you the kind of needles that he uses as well. Okay. So this is the jaw point. Kita nyo to? Yung panga. So dito nyo ini-needle. Okay? You use intradermal needle there. Diba? So, the idea here is to tighten the mandible, yun dito. Para mag-tight. Pag ganon. So it's easy for you to pull. So talagang babanat siya. So again, find mo the stomach 5. I'll show it to you when we, the muscle kasi here is platysma. No? So next, we go to the front of the face. So first ito, the cheek. Where's the cheek? Here. Number 49. Here. Here or there. Oo. Or i-needle mo na lang. O sige, I'll give you a technique. Tell me if it also worked for you. I would put 10 intradermal needles here, 10 intradermal sa pero later na lang kasi you need to know talaga yung totoo. But I also notice it to be effective, no? Yung mga tender points. So if it's tender, they need to be lifted. They need to be needled. Okay? This one is stomach 4. As you can see, it's in line with if you imagine the patient to be looking forward, ito yung stomach 4. So, pag needle niyan is pag ganon. Hindi pag ganon. Pag ganon. Palabas. So, andito po ang stomach 4 for the ear. So, this is stomach 5. So, andito stomach 4. If you notice, ang dami lang dito. Diba? 10 needles. 10 intradermal needles. I'll show it to you. But now, yung munang kailangan yung munang mag-effort, no? Stomach 4. And this is LI20. Okay? So, on the ear, we have here the LI20. Do you see some connection, di ba? Parang dito lang talaga, lagay mo na lang lahat dyan. Do you agree? Oh. Di ba? It's all on the lobe because the lobe is the face, right? Remember? The points on the lobe, of the lobe. And then here is when we do the needling of LI20. Okay. And then this one is stomach 2. So stomach 2 is here. No? Stomach 4, stomach 2. So ganun din, no? Then stomach 3, SI18. SI18 is here. Do you agree? All of this here are face. So you have to needle the tender points, no? And then we have this is stomach 2. Stomach 2 nandito. Now let's go to the chin. This is a little bit masakit here. So you have to do it with, especially pag may hair or may balbas. Actually, you will be surprised. There are a lot of men who want to look good. Okay? There are even more men who are interested. You may have all the money in the world, pero kung mukhang bangkay ka naman doon, medyo, Okay, so this is REN 24. So if you need to put siya sa tenga. It's not already in the tenga, no? Okay, REN 24. Now the neck. Now, this is important. Don't forget the neck. Kailangan ma-lift mo talaga yan pag ganon. especially here. Okay, show you. Okay, if you're a little bit daring, try to needle stomach 9 if you can. Just avoid the big artery there. Okay. Ito po yung SI-17. So if you nakaganon yung pasyente nakahiga, obviously, ipapagano mo siya konti, ilagay mo dito. You know, pull mo siya. Or better use this. You see? Tadtarin mo na maraming needle yung intradermal. Okay, and then SI-17, okay, SJ-17, behind the ear, behind the lobe, dito. So dito, it's here. See that? SJ-17. And then we have REN-23. REN-23 is here. Diba? Stomach 9.
I'm sorry.
So stomach 9 is here. But this is 10. So 9 should be here. Keep it closer. Yeah, you saw stomach 9. It is.
Mauna na daw tayo.
Can you please mute, Sir Albert? Okay. Then additional points, you have stomach 13, so it's here. Gallbladder 21. So here is gallbladder 21. Okay, contraindications for the ear acupuncture. What's this? This is with regards to the face. Those who are doing sa face, not sa ear. Okay, for example, yung nagpa-microdermabrasion, laser resurfacing, surgical facelift, recent Botox or fillers, you have to wait 3 months. But if you do it on the ear, there's no problem, di ba? Do you agree? So why would you do the face? You know, usually those who want like naka-Botox, you have to wait 3 months, but you can use the ear. Amazing, di ba? Chronic migraines, so uncontrolled high blood pressure, uncontrolled diabetes, cancer, trying to have a baby, pregnant or breastfeeding. So yung mga may history of miscarriages, don't do the ear. Okay? Those with pacemaker, you don't do that during cold or flu, during allergic reaction, excessive bleeding or bruising. Okay? Now, number 11. Ito na yung dalawa dito. All of my patients, they have that. Actually, that's one of the main reasons why they want. They want to make sure na nawawala. Okay? Do not expect the line to disappear on the first session because there are lines that are too deep. No? So, of course, usually it will take 3 sessions. And the charging would be different based on the area. I don't know how you charge, but sometimes isama mo lakihan mo na lang yung presyo sa ano para kasama na. Okay? Yan. Do you see can you see the intradermal needles? Yes? Yeah. Ito naman, another one. So you can actually. Now, what is the idea of using intradermal needles for lines? Okay, why do they work? Because when you insert the intradermal needles, you are actually creating a wound. Sinusugatan mo siya. Okay? And so pag may sugat, when there's a wound, it will stimulate collagen production and elastin. Okay. And expect a little bleeding, especially if, because remember, lines are a sign of dryness. So you should always be ready with a piece of cotton, dry cotton ball. Okay. And you should be happy when you see the blood because that means it's working. Because if there's no blood, there was no wound being done. So there will be reddening of the area, like for this, ito, pupula ito. So you have to wait for the redness to disappear before you remove it. Okay? So it would be best if you have two patients, di ba? So pagkatapos mo dito, you go to the next one. Okay? So yon. Okay, another very common ano is this one here. Merong iba malalim. Oo. Actually, ano, Sir Albert, he knows who I'm talking about, no? A friend na partner ng lamp ngayon. He was amazed kasi super lalim yung dati. Kasi ang laki-laki. Ay, baka man. So ngayon medyo ano na siya, shallow. Kasi this is how we needle. So when you needle using it's this, intradermal, it has to point towards you. Okay? So if the lines are too deep, the intradermal needles should be close to each other. Okay? Huwag magtipid because it might not work fast. So when the lines are already shallower, that's the time you have to space them a little bit farther apart. Yes? Okay. Di ba, Sir Albert, mura lang naman yung meron tayong mga special price sa intradermal needling. Oo. Kaya kung ako sa inyo, order na kayo, mauubusan. This one is crow's feet. You have to be very careful. You know, crow's feet, yung nandito sa ano, dito. Okay, there is always the possibility that you will create a bruise. Kaya be careful, don't put too many needles. But again, you have to caution, ma'am ha, kung medyo nagkapasa, no? It will take about a week to, or mag-ready ka na ng ano, arnica, no? Something that will erase it. Okay. If possible, don't you have to advise the patient to use gua sha, no? Ano, um, there. Okay. So thank you for part 2.